Hey, I'm Robyn Openshaw. Online, I'm the Green Smoothie Girl, and I flew to the Swissmountainclinic with 43 Americans. This is my 11th time here, but it's my first time with the honor of meeting Dr. Simone, who is a new addition at Swissmountainclinic, and we are all fascinated by you because you have one of the very elite specialties in medicine. You're a cardiologist. And yet you come to us to help us heal our whole bodies. So I would love to know what brings you from cardiology to this amazing clinic up in the Alps.
So that this is for me, a very emotional question because it actually started when my daughter got sick with, let's say, by now 2.5 autoimmune disease. I say a half because we don't know what the third condition is. And so I started to investigate many years ago already how could I help her. And I brought her to any expert I would know to be able to make the situation better for her, to make it easier.
How old was she?
She was like 17 years old when it started. And then a couple of years later, so it started with a thyroid disease. It is morbus basedow in German, and forgot the English name. But then 2 years later, she was diagnosed with diabetes type 1, which was quite a shock because she ended up on ICU. I tried to help her initially with conservative methods, but autoimmune disease would go on, and so I had to.
You get more and more autoimmune diseases if you don't treat it. Yeah.
Right, and so we tried everything, and in the end, I didn't know what else to do. And then there was a second patient, a very close patient of mine, and he was suffering from severe side effects of the medication I would prescribe to him. And this was then the second time when I started to think there must be something else next to prescribing medication. There must be a possibility of healing yourself, or at least I wanted to have a look at it. Because he would also ask me, he would say, if I have to take this medication, I don't want to live anymore. So can you please just have a look what else there is? And so I did, and that was the start of my journey and how I ended here.
Well, I came here almost by accident. I went to 20 clinics all over the world, and I was going to write a book about what's good about each one. The problem is I didn't find much good in most of them. And I really liked this clinic, and that's why I've been here 11 times now. I'm not sick, but I bring 43 people with me. This time I've brought hundreds of people with me. This place is very special. The energy is special. The Vico family, investing years of their life to it, every attention to detail. They live on site. Those are what attracted me. What do you like about being here? I mean, you have to move to this small village.
Mm-hmm.
Why?
Because I also see that they take these things very serious. They have great experience in what they are doing, and there is really the urge to understand what it needs for self-healing. I find that here, and I understood, or I think that I'm understanding. I'm here for 6 months only. That if you really want to help people, you have to understand where they come from. So you have to understand, and as a doctor, you can try to help people in understanding why they got sick. And Petra is just an amazing person. You can learn this from her, especially this attitude. And if it comes to disease, for me, what is most important is to deal with our chronic negative stress and trauma. And I think this is a place where you can address these issues. And then almost on the same level, it's also nutrition, right? So what we are eating is so important, and there are many, many other things, and so this is why I'm here, in short.
Yeah, it's so unusual to have a place that is a restaurant and a hotel and a medical clinic all in one. Right. I did not find this in my travels all over the world. And so you're only here for 6 months. Are you giving it a trial basis and deciding if you want to stay longer?
I will definitely stay longer. I decided that already, and the mission, or my mission, is also to bring together advanced cardiology with a holistic approach. So therefore, I'm also working here with very advanced methods, like 3D ultrasound of the heart, and also checking the vessels from head to toe. We would also then have the opportunity to go even further with cardiac CT and cardiac MRI if we think that there is a need.
You want to bring more cardiology to the clinic, is the sense I get. Is that right?
Yeah. But then also close the gap between the, so to say, conservative medicine or conservative way of thinking and the holistic way of thinking. Because I do think that these things have to go together.
So has it been strange for you to learn about 1,000 different approaches to things when you used to have your, I don't know all the classes of drugs, but I know statins. Has that been a big learning process for you?
A very big learning process, but I see it is a challenge, of course, especially in the beginning, but then it's also a richness, right? And I understood also that healing is not this one thing only, right? You have so many different people and so many different needs, and one method is good for one person and the other method is good for another person. And to understand that was really important because I didn't do that before.
Well, we need this special place to have special doctors taking it into the next phase, because we can't watch what Petra and Ulf Wiechel did with it. You know, I was here in 2011 when it needed lots of work, and it was still the best place. I went in 20 places around the world, still the best place. And now they've invested so much in it, it's spectacular. And so I hope you like it here. I hope, because Frederica, the daughter of Dr. Petra, has been raised up by Dr. Petra, but now you don't just see people with heart problems, now you see all of us.
But yeah, having a daughter, dealing with autoimmune disease, and also understanding that one person is not just, we are not just a heart.
Yeah.
So we have to see it more holistically. So we have to see the whole body. We have to,
There's more.
There's more, yeah.
And how old is your daughter, and how is she doing now?
She's 26 years old, and she's doing great, I think. Yeah, and she'll come to this place in September for the autoimmune weeks to understand more about her way of, and also about nutrition and the importance of taking care of yourself, I would say.
What do you wish patients would do? That you teach them, they want to take some medications, they want it to be easy. It's not hard to get people to take medications, well, especially the kind they prescribe here, which are not drugs. You mentioned your patient who said, I'd rather die than take these drugs. Did I understand that right?
Yeah.
So it's not hard to get people to do that. What things do you wish they would do that if they did, they would get well?
So first of all, I would say that they would have to have a close look to where they are at the moment. Whether they are happy in life, or whether there is something there, what is missing. I think this is a very important question. And then also, it's very important to have a look at your nutrition, right? What are we eating? So Petra and Ulf are always saying the first therapy room at this place is our kitchen. Because all of the vitamins and minerals we need to stay healthy are in our food.
They make amazing food here.
Mm-hmm.
And I leave dinner and I realize that I just ate cabbage and carrots and half of a potato, and I felt like I ate like a king.
Yeah, yeah.
Because they make it beautiful and
right.
3 courses or courses.
So it's very important to see that healthy food can also be joy, right? Because you put so much love in it while preparing it.
Mm-hmm. And we sit together at the table, and I've done 10 retreats here, and everyone loves the food. And I'm glad I didn't have to make it. Well, we're so glad that you're here. I know that Dr. Petra is looking for that very special doctor to take the next generation of this clinic. So thank you for being with us, Dr. Simone.
Thank you, Rob.